Hello everyone, thank you for tuning in again. This is Dr. Michael Sistare with Palm Beach Cosmetic Surgery. My last video addressed something called an upper blepharoplasty, which is repositioning of the excess tissues in your upper eyelid. I'm going to take this opportunity to talk to you a little bit about a lower blepharoplasty, addressing the puffiness and the redundancy of skin in your lower eyelid. It's not uncommon that someone wakes up in the morning and they look at themselves in the mirror and they notice some puffiness under their eyes. Normally it gets better as the day goes on, but for people who have an exceptional amount of sagging and puffiness under their eyes, it could be due to a few different things. Most commonly, it's due to an accumulation of fat in the compartment underneath your eye. Other reasons that you could have it is there's an excess salt intake and fluid intake, which makes all of the tissues in your body puffy, and it just manifests in your lower eyelid because those are most visualized. And then thirdly, you could have sagging muscle. The muscle around your eye is lost in tone, and that could manifest as a little bit of puffiness under your eye. There's two different lower blepharoplasty techniques that addresses the swelling depending on the reason that you have it. The transconjunctival lower blepharoplasty, trans means across, conjunctiva refers to the pink tissue underneath your eye right here. We can make an incision in the pink tissue behind your skin, go in, remove excess fat and reposition muscle, and then we don't even have to close the incision with suture. It closes naturally. It heals very quickly. In the first 24 hours, that incision's already healed. And the most beautiful part about this procedure is there's no external scarring. No matter what you do with this, since I didn't make an incision on the outside of your body, nobody can tell that anything was done. There are some people where a transconjunctival blepharoplasty isn't going to give them the results that they're looking for. Those are the people who have an excess amount of specifically skin on the lower part of their eye. I can't remove skin coming from the back. I have to remove skin by making a very, very small incision under the eyelash, under your lower eyelash. It's very well hidden by the eyelash itself. But in order to remove that skin, I need to make that incision and excise the excess skin. So that's called a transcutaneous lower blepharoplasty. Trans meaning across, cutaneous meaning your skin. So even though there is an external scar, I challenge you to find it once it's completely healed. It's very well hidden by your lower eyelash, like I said. The recovery is very tolerated from both approaches, from the transconjunctival and the transcutaneous blepharoplasty. Both of these need to be done in an operating room because it requires a little bit of sedation, considering we're working around your eye and it makes some people uncomfortable. And the last thing you want is to be uncomfortable when it's not necessary. So it's easier for these procedures to be done in a surgical center or an operating room. Don't take that long, 30 minutes to an hour. Like I said, the recovery is very tolerable. Not very painful, but you might have a little bit of bruising underneath your eye, might have a little bit of swelling from the act of surgery itself, but that tends to go away pretty quickly. Very tolerated procedure, very common procedure that people pursue because most everybody, at least once in their life, has looked up and said, why are my eyes so puffy? So that's a lower blepharoplasty in a nutshell. If you have any more questions I can answer for you, please comment below and I'll make a specific video addressing as many questions as I can. Once again, the practice is Palm Beach Cosmetic Surgery. I invite you to come meet me, talk with me. Consults are free, and I can figure out exactly what I can do to help you achieve your cosmetic goals. Thank you so much.